Deputy Woodland, we are ready whenever you are, sir. Winslow, I think you're muted.
Good morning. Can you?
Winslow, I'll unmute you. You are unmuted.
Good morning, everyone. This is Winslow Woodland, Deputy Director for the Developmental Disabilities Administration for the Department on Disability Services. I'll be sitting in for Director Andrew Reese, who's in a meeting, and he will likely be joining us at the end of that meeting. I'd like to start off by giving you the statistics on COVID-19. We have currently 235 confirmed cases. We have 2 people who are hospitalized at this time. We've had 122 people who have not required inpatient care, and we have 79 that have been discharged. And sadly, we've had 32 people who've died as a result of this virus. 5 of those deaths are people who've tested positive, and we have not received confirmation as to whether the death was actually related to COVID, and we're awaiting that from the Office of the Chief Medical Examiner. The distribution of cases is as follows. We've had 4 in host home, we've had 86 in ICFs, 16 in natural homes, 2 in nursing homes, 27 in residential settings, and 100 in supported living settings. To date, we've had 268 staff who have tested positive, and 9 of those people worked at least at 2 providers. And sadly, we've had 6 of those staff members expire. The death distribution by month: in April, we had 18 deaths. May, we had 8 deaths. Oh, wait a second. I think, May, we've had 8 deaths. June, we had 1. In July, we had 3 deaths. And in August to date, we've had 2 deaths. Today, we have 2 presenters. We have Ms. Danielle Dorsey from MTM, and we have Michael Siegelman. Ms. Dorsey is going to talk about MTM, and then Michael Siegelman is going to do a presentation on PPE. So I'll just turn it over now to Ms. Dorsey.
Thank you so much, Mr. Woodland. Bear with me 1 second. I'm just going to share my screen so that everyone can see my information. So good afternoon, everyone. Thank you again. My name is Danielle Dorsey, and I'm the Community Outreach Trainer with MTM. I thank everyone for giving me the opportunity to talk about our services, as well as how we are responding during this pandemic and our benefits for our members in the district. So MTM is a non-emergency medical transportation company that's been around for over 20 years. We're a mom and pop organization, family owned and operated, and our capabilities have reached nationwide from communities east to west coast and servicing members that may often face barriers when getting to appointments, which is why MTM's vision is to remove those barriers. For those that are eligible, transportation, or more so MTM receives an eligibility download monthly of eligible recipients for transportation. The plans that we are going to cover today for benefits are going to be Washington, D.C. Medicaid, as well as our IDV waiver population. Any recipients that are at least 18 years of age or older are able to request transportation, as well as our parents of our minors, legal guardians, and authorized representatives, such as those as our social workers, as well as our case managers, service coordinators, and also other authorized staff on the member's behalf. At the time of the call, the agent will ask for the person calling on the member's behalf, the name, the relationship to the member, and a callback number for any notifications or updates that need to be provided for a member's request. This is the number for our reservation needs, as well as in the event if a member is trying to locate transportation. And you also have the reservation for those that may be of our deaf community or hearing impaired. When contacting MTM for reservations for routine appointments, these can be made Monday through Friday from 8 a.m. to 6 p.m. Eastern Standard. And then you also have your urgent appointments, which can be done Monday through Sunday from 12 a.m. to 11:59 p.m. So I want to get into the different types of appointments. There are different types of appointments that our members in the district do travel to. You have your routine appointments. Normally with these are our preventative appointments. They don't require the member to be seen right away, but these are going to be things like an annual checkup to a primary care physician, maybe routine cleaning at the dentist, or even an appointment to a podiatrist for a follow-up for a foot procedure. With these reservations, they must be scheduled within 3 business days prior to the appointment. But then you also have your urgent needs. Now, for these appointments, the members may not have to necessarily contact 911, but they do have a life-sustaining appointment and need to be seen. So some of these are going to be chemo, as well as radiation and dialysis and hospital discharges. With these requests, the appointments, we know that these can be given at any moment's notice, and they are also requested for transportation. What happens is the representative will verify with the facility for any same-day requests to ensure that we can locate transportation for the member. However, appointments such as dialysis appointments, chemo, radiation, anything that is considered life-sustaining, these are considered automatically urgent, and they do not require verification. There are various modes of transportation for the member as well. For those that are independent and capable of using public transportation, we offer a Smart Trip card that is funded 24 hours prior to the appointment for transportation for the beneficiary. For those that are not medically capable of using public transit and are in need of transportation, we do have a vast network of providers with multi-passenger vans to provide the transportation service. Also, for our members that are wheelchair accessible and in need of a paralift for transport, and also that assistance in and out of a vehicle, we do provide transportation via a wheelchair van. And then also for members that may need a little bit more extensive transport, maybe they are in need to travel while lying down due to being paraplegic, we do have stretcher transportation. And lastly, for those that do prefer to use their own vehicle, maybe they have a friend or a neighbor or relative that can take them to their appointment, we can offer gas mileage reimbursement, and we'll be able to put money back into the pockets of the members to take themselves to their medical appointments. With the process of gas mileage reimbursement, beneficiaries must contact MTM prior to their appointment in order to obtain a trip number to be added onto a trip log that is given. Trip logs can also be obtained by the email address that we have on the screen, or at the time of the call, a request for a trip log can be requested and they can be mailed out to the beneficiary's home. With trip logs, they must be submitted within 60 days of the appointment, and the rate for gas mileage reimbursement is at 54 cents per mile, and the compensation is given out via a paper check to the address of choice for that beneficiary. Any single trips, like maybe a pain management appointment for next Friday, for example, or recurring trips, these can be scheduled by the member or facility staff. Recurring trips, such as consistent appointments that are going to go to the same location, the same days and times, can also be scheduled and placed with a provider for a designated time frame. So when it comes to dialysis trips, these will now be scheduled indefinite unless there's a change to the member's transportation request. And any other recurring appointments, maybe for physical therapy, for example, these will be scheduled for a period of 3 months. For these types of trip requests, the representative will ask for the days and times that the member needs to go, as well as the facility's location information to make the request in the system. These are a few pieces of information that is needed when scheduling transportation. You have the beneficiary's name, as well as the address and phone number, the date of birth and Medicaid number, which is captured in the beginning of the call. Then also the date and the time of the appointment that is needed, as well as the time that the beneficiary will be needed to return home, if it is known. In the event that the member is unsure of their time to go home, we can utilize a will call. We would also need the medical provider's address and phone number in order to locate the member, or more so locate the facility in our database, and then also to capture the special needs of the beneficiary that they may have that would need to be accommodated. Maybe in the event if a member travels with a cane, a crutch, or they are wheelchair accessible, as well as the type of appointment that the member will travel to. And if required, we do allow 2 additional passengers. But for our beneficiaries that are single caregivers, they can take all of their minor children as additional passengers. We would not more so question at all. We will transport all additional minors as passengers. Now, for our minors that may be traveling alone, a parental waiver must be on file prior to the appointment in order to travel unaccompanied. Typically, when making these requests, it's best to always provide as much details as possible to the agent, informing them they are in need of traveling alone, as well as a fax number or an email address so that the parental waiver form can be sent out. Once completed, it can be sent to the email that we have on the screen to be placed on file. There are exceptions to this rule, especially in the event that a member is expecting or is a parent. In these cases, we do allow them to travel by themselves. We also provide transportation home following hospital discharges as well. When requesting discharges, there is a 3-hour time frame to locate transportation. But NTM should be contacted as soon as the discharge planner is aware of that discharge. Now, what this does is it does reduce the 3-hour time frame in locating that transportation provider. So, for example, if the discharge planner is aware that a beneficiary is going to be discharged at 8 a.m., and let's just say that discharge is going to be for 12, it's always best to contact us to make sure that the reservation is scheduled ahead of time, which would reduce that 3-hour window. But there are times where, in the event, maybe that time that was initially requested to be discharged may have to be changed. maybe in the event the member needs to go back for lab work prior to being discharged. Please give us a call at the reservation line to update that time, and we will attempt to locate a transportation provider to accommodate the member home. For those that are medically dependent and capable of traveling on their own, we can dispatch a local driver using our Lyft portal, which also reduces that time frame. But again, those are going to be for those that are capable of traveling on their own. Now, during these unfortunate times with the pandemic, MTM does follow CDC's guidelines as well as those recommended by DC Health to ensure the safest environment and smooth transition back into the community for our beneficiaries that we do serve. Below are a few directives that our transportation providers are following. We do ask that our providers observe social distancing guidelines that are directed by CDC's recommendation when transporting members. Drivers and members are also asked to wear PPE when transporting, as well as hand hygiene. This is enforced very frequently. Our drivers are instructed to wash their hands as much as possible in between their transports, and also to keep hand sanitizer readily available to use when needed. Signatures that are captured at the time of pickup and drop-off are not needed at this time, just to really reduce that contact and remain within CDC's guidelines of proper social distancing. And cleaning of vehicles are done at the start of each shift, each day in between transports, and then thorough cleanings after the end of the day. So MTM as well as DC Medicaid has entered into a business associate agreement, and we do permit MTM to receive certain recipients' PHI information. So upon the time of the call, verifications are needed for any members that are attending appointments on which they would utilize the benefit. These may be for same-day requests, urgent trips, for example, where we would have to verify for the transportation. But we do make sure that we stay within our compliance of HIPAA. So there are expectations when scheduling transportation. At the time of the call, the caller can expect the agent to recap them of all of the information that is taken during that call, as well as the time preparation. We do ask that the member be ready at least 1 hour prior to their scheduled appointment time. The day before their appointment, they can expect a call from the transportation provider to confirm an estimated pickup time. But I always say, in the event if they have not received the call, please contact the reservation line to get that information provided. Now, the day of the appointment, it is encouraged that the members are ready to board the vehicle 1 hour prior before the member arrives. And in the event if the ride is more than 15 minutes late after the expected pickup time, the member should contact MTM. In the event that a member has an appointment at 8, for example, and the transportation provider has contacted them the night before, and they said that they will be there around 7:10, but it looks like it's now 7:25. Please give us a call, and we will make sure to notate what has happened or occurred at the time of the call. We will attempt to get in contact with the driver to locate that transportation. And then in the event, which we would not want this to happen, but if transportation is in the delay, we will attempt to locate alternate transportation. Bear with me just a second, my computer is froze. And when traveling home, after the appointment, the member can expect the driver to arrive no more than 30 minutes after their scheduled return time. But in the event that the beneficiary is waiting more than 15 minutes after that time, they should give a contact to the MTM reservation line so that way we can gather an estimated time arrival for the provider. Now, for those that do not have a scheduled pickup time and they have been placed down as a will call, they should contact the reservation line after their appointment. This will ensure for us to contact the transportation provider to let them know that the member is ready to return home, and the driver does have up until 1 hour from the time of the call to pick up the beneficiary. And for those times where we may drop the ball, to file a formal complaint, you can contact our Quality Management We Care line at the number above, and then also submit email requests for any complaints, grievances, or inquiries that may be regarding members. And I thank everyone for your time. I do want to open up this time for any questions you may have.
So just to a couple of people, this is Deputy Dobson. Just a couple of people want to know if this presentation will be available online or after this meeting.
Say it one more time. I do apologize.
Folks want to know if this presentation will be made available after this meeting. Is there any way you can share this presentation with DDS so we can share it out?
Oh, absolutely. I will send this over for distribution, as well as the directive that we follow by DC Health as well. And
Question.
I do see,
Oh, you can see the questions. Okay, perfect.
MTM limiting the number of passengers that are on the vans. We are asked to skip a row. There is a seating or more so a passenger capacity. We are asked to skip a row, as well as to limit to no more than 3 passengers in a vehicle. But I will provide that clarification as well in the email that I'll send over with the PowerPoint for distribution.
Great. Somebody asked, what to do when MTM transportation keep canceling at the last minute, even after multiple complaints?
So I couldn't imagine what may have occurred for any past complaints or past concerns. But in the event that there are any cancellations, especially when they are known, I would say to give a call to the reservation line so that way we can look into why it may have been canceled. We can try to locate an alternate provider. And also with the email that is provided below on the screen, please feel free to get in contact with me for any of timely issues that may have not been addressed, and I can look into those matters with our logistics team. But in the event that maybe transportation is canceled for those unknown reasons, I do say to please give a call into the reservation line so we can look into what may have occurred with transportation for those matters.
Fantastic. Question just came in. What is the plan for when MTM is transporting people who medically cannot wear a mask? Will other people be in the vehicle with them or not?
So that is a great question. For those that may not comprehend or understand of the grasp of utilizing the mask, or those that may have restrictions with breathing, we do understand in those manners. What I can do is to gather clarity to see when those instances are occurring for our vulnerable patients or passengers, will they transport alone? I can gather that information and then provide it back over to you for more detail.
And I'll make sure to get to the person who asked the question and distribute the answer. Danielle, thank you so much for your time in this presentation. If there are any other questions, I'll make sure to forward them to you. And if you have anything for us, please just share it with Crystal or myself, and we'll make sure to get it out to our providers in our community. Thank you.
Absolutely. I thank you guys so much for your time, and you have a wonderful afternoon.
You too. Crystal, I'm going to turn it back over to you, or to Winslow, I'm sorry.
Director Reese has arrived, so I will pass it over to Director Reese and see if he has something to say.
Good afternoon, everyone. I'm sorry that I was late in arriving today. but my understanding is we have another presentation now from our nurse educator, Michael Siegelman. So I'll, just as Winslow just did, I'll punt to Michael.
Bear with us 1 second. I'm just having trouble finding him in this chat. Unfortunately, Dr. Reese, I don't think Michael's with us at this moment, so I think we may have to.
Okay, in that case, I believe that we had some questions that had come in. So perhaps, Crystal, you could go to the questions, and while we wait for Michael, we can respond to those. The other thing is, I don't believe, before we get to the questions, I don't believe that in the opening, Winslow spoke to the status of our day reopening. And so I just wanted to walk through that. People will be getting, either have gotten today or will be getting today. All of our day providers will be getting communication from us about what the next steps are. We reviewed last week with people the current draft guidance from DDS that was developed with assistance from some of our providers, with the Reopening Day Services Committee, which was, I thought, a really good and thorough presentation last week. And so that's a guidance on best practices. What it does is identifies the 12 areas that providers need to consider in developing their plans for reopening. In addition, DC Health's guidance on adult day programs was issued. And so standards that exist, you will find in the DC Health guidance, as well as reviewing CDC guidance that is included in DDS's best practice guidance. You will notice when you receive the best practice guidance that it does still say draft. If when we get the final version, there are substantive changes that require any changes to any plans, we'll let you know. But we thought it was important to have this, at least the framework out, so that people could begin developing their plans now. And as I said, the actual standards are in the DC Health guidance as well as CDC. This is just the structure for how each provider will develop their plan. In addition to this plan, there's also it's referred to as a one-pager, but I've often drafted one-page guidance, and I end up redefining what one page means. So anyway, there is an attached one-pager that's a brief description of how services have been impacted by COVID and what services will now be provided by the day program, because the best practice guidance and the reopening plan that we're asking for doesn't actually speak specifically to the services that the providers will be offering. And so this one-page template that will be provided, which gives instructions for how to complete it, will describe what those services are and how they have been adapted to ensure people's safety during COVID. And so those will be going out today. And as soon as we have those, as soon as a provider completes the plan, they'll turn it into their quality resource specialist, and those will be reviewed by the quality resource unit as well as health and wellness. And then once a finalized plan is available, the provider can provide those to the various interdisciplinary teams that are considering people's community participation assessment and questionnaire documents, and begin moving forward with providing day services. So from there, Crystal, are there questions?
We do have questions, but Michael Siegelman is ready to present on PPE. So
Okay.
I will punt it to him.
Very good.
Michael, you are muted.
How about now?
Now you're good.
Okay. Am I presenting the entire PPE presentation now?
We have about 20 minutes, Michael.
Okay, I will share my screen now. One moment.
Well, I'll say 15 for
Okay.
questions, okay?
Okay, one moment. Okay. Let me get out my notes. My apologies for the delay. Okay, so I'm going to go through this a little faster than usual because it turns out it took me longer to present this morning. Please submit your questions and I will cover what I can. So this is the COVID-19 hygiene and PPE usage when returning to work during phase 3. And my name is Michael Siegelman, and I'm a registered nurse and the nurse educator within the DDA Health and Wellness Unit. This presentation is for people who are returning to work during phase 3 and who would be required to wear personal protective equipment or PPEs to perform their assigned tasks. We will also briefly discuss how to properly wash your hands, reviewing basic hygiene practices, and to review when and when not to wear gloves and masks. So some basics, which we have heard multiple times over the course of our Friday forums with Director Reese. Some basics are to always wash your hands, do it frequently, cover your mouth with a tissue or by using your elbow when you sneeze, cough, or a tissue preferably when you blow your nose, and do not touch your face with your hands. Obviously, if you need to touch your face, but it's preferable that you would wash your hands first, but always wash your hands immediately following touching your face. Also keep in mind that, we're told to watch the surfaces that we are touching. With that in mind, remember that when you are, if somebody sneezes into their elbow or coughs into their elbow, if you are a touchy-feely person and you go to touch someone's shirt sleeve, COVID virus may be on their shirt if they sneezed into it. So just keep that in mind that, wash your hands frequently and always, no matter what you touch. I hope that made sense. Okay, as we've also heard, wash your hands for 20 seconds. And that would be the happy birthday song twice, or someone said earlier in my first presentation, the ABCs once, which is a good memory device. So either happy birthday twice or sing the ABCs once. Also, keep in mind that CDC states that if you don't have warm water to use when you're washing your hands with soap and water, for whatever reason, it's still beneficial to wash your hands with what you have. So if it's cool water or cold water and soap, it's fine, use that, as long as you're washing your hands. So let's talk about hand sanitizer. You can use hand sanitizer if your hands do not look dirty. So if you don't see anything visible on your hands, sanitizer is acceptable. The hand sanitizer you use should have at least 60% alcohol. And when using hand sanitizer, remember to rub your hands until your hands are dry. I'm sure you've seen people when they wash their hands, they do it for 5 seconds and that's it. I've seen many people do that also with the hand sanitizer. Your hands should be wet, and rubbing your hands until they are dry, that should still take you about 20 seconds. It all depends on the brand that you're using. They might have different requirements for how long you rub your hands, but vigorously rub them. Try to make it for 20 seconds. If you time yourself, you'll see that most people do it for far less. Also remember that when you wash your hands, whether washing with soap and water or using hand sanitizer, you do the bottom or the palms of your hands, the tops of your hands, like this, and between thumbs and fingers. And this is how we're taught in nursing school, how to wash between your fingers. If you do it like that, you can't do it in less than 20 seconds. So you should wash your hands frequently, as we said, but to give you a little more, that would include when you get to work and before you leave work. That is because you don't want to bring germs into work and you don't want to take germs with you from work. You should do this before and after you eat, before and after you use the bathroom, and as soon as you get home. So even if you go straight from work to home, you washed your hands when you left work, you're still touching things, whether you're touching your car steering wheel, or you're touching the door handle to get into the Uber, or you are using metro or bus, you're still touching things. Wash your hands. This also includes after touching any surface that might have COVID-19 on it, after coughing or sneezing, and after blowing your nose. And remember, we don't know what has COVID-19 virus on it. So anything you touch, wash your hands, which is why we've all been saying wash your hands frequently. Okay, I'm not going to do this quiz because I don't see the chat box because of my computer screen, and we probably don't have time for the quiz. I will be doing this again on Monday for the second presentation. I believe we have, I don't know how many people we have signed up for the Monday session, but no, forget it, sorry. Okay.
Okay, thanks, Michael. And if people have any questions for Michael, I just want to emphasize for people, although at the beginning it says, about employees returning in phase 3,
Oh, I'm sorry. Yeah.
No, that's no problem at all. What we have seen in our recent numbers is that in July, we really saw the curve go down into June, and in July, our numbers start picking back up again. We've seen that in the District of Columbia, and we've seen it within DDA. And what I hear from public health people in the media regularly is that what we need to do is follow good public health practices of face covering, using PPE, washing your hands. And so I think that it is essential that we regularly reinforce these practices with people. So, Crystal, were there questions? I see there are questions in the chat box, but I want to make sure to get to the questions as well that people raised.
Yes, we do have a few questions that was submitted. So question number 1, if an individual is approved to attend 2 days in a week and is unable to attend 1 day, is there a provision at this time where we can get paid for those days? It was discussed that a person can choose to attend in an alternative day. However, it is going to conflict or affect the schedules for the other people attending the program on those days due to the limited number of individuals presence is required to maintain the safety of the people we serve and the staff.
So the way that the day hab rate is constructed, it anticipates an 85% attendance rate, and so it does have built into it an expectation that the person may miss some days. What that means, though, is you don't bill for the day that they missed. It means that if they miss 15% or fewer days, then you have already been paid for that.
Okay. Can the residential providers pay the monthly payments from March 15th till current for all ICF IDD individuals to sustain our business monthly expenses and staff salaries?
So if I'm understanding the question, ICFs for active treatment generally pass the active treatment payment along to the day provider. However, since the day providers have not been providing services and the residential providers have therefore had to provide those services, they've retained those funds. What we have had available from March until sometime in July, 90 service days of day programming can be paid through the retainer payment that is available through the agency's Appendix K, which we got our additional questions and responded to all of those, and CMS has the Appendix K, and I am hopeful that very soon they will get back to us. We have responded twice to them in the last couple of weeks, and I believe we've gotten the last of their questions, I hope, but the amended final Appendix K is with CMS. For day providers who are exclusively day providers, I don't know that there's any real differences in that. And so day providers could have been submitting claims for retainer payments since March. What will be necessary, however, is, to the extent they're able, day providers really hopefully need to have accessed the PPP funds that are available. I try not to speak in acronyms, but I don't speak in acronyms when I know what the words are. So there are the federal funds that were available through the CARES Act for small businesses. There's also the reimbursement from HHS to Medicaid providers. And the deadline for this has been extended a couple of times. And we have sent that information out to all of our providers. And so, people should also take advantage of those funds. Someone doesn't recognize that the microphone on their tablet is very close to the keyboard. Next question.
That's probably me. Can we have MTM transportation representatives attend the day providers meeting to discuss their plan to safely transport the people we support?
We can certainly invite them, or we can give you Danielle's contact information so that you can invite them.
And I can extend an invitation to Danielle.
Thank you very much, Morgan. Paycheck Protection Program, PPP.
Next question. PA account balances in MCFS should not reflect the stimulus payment received, as these funds will be placed in the person's community account or trust account, correct?
So I want to clarify, I just got clarification from someone. Retainer payments are only available for people getting waiver services. And so if if someone was not paid as a waiver provider, they're not eligible for retainer payments. They're only available for people that get the retainer payment. Sorry to have misstated that. I got that question this morning and forwarded it to the person that can answer it, and I don't see a response yet. The question regarding how those funds are reflected for the person.
Okay.
And I sent it to Jared, not to put him on the spot, but he was in the same meeting with me, so I don't know if he has joined this meeting yet and is able to answer that question.
So I don't see him on the call. I'm not sure if he dialed in. Another question, is Michael going to talk more about when and how to wear PPEs? His presentation focused on hand washing. So Michael did an abbreviated presentation, and the extended presentation does include information about how and when to wear PPEs. So I am trying to find out when Michael will present next, but it is in his slide deck, which we can make available. Any other questions at this time?
The thing about muting when you're going to use your keyboard is you forget to unmute. I was going to say it's really essential, the additional training regarding when to use PPE, because, you know, for our day and residential providers, the kind of interaction you're having with a person dictates the kind of PPE that is required.
Definitely. And Michael, he will be training on Monday, the 10th, from 10 to 11. And so you're able to register at TIS right now if you wanted to take that training.
So in response to the question regarding the stimulus checks, stimulus monies will be placed in a person's community account. So the other question that I saw here is employment readiness. So we are able, through the vocational rehabilitation grant, to pay for job readiness. And I apologize because I expected to have point by point today exactly what steps need to be taken so that virtual employment readiness by a current employment readiness provider could begin for our folks in their residential placement. Just to sort of walk through that, I expect that all of our employment readiness waiver providers are already providers for RSA, because any employment readiness provider was required to become a supported employment provider with RSA. Now, they may not be, in RSA, it's called job readiness rather than employment readiness, but the service is the same. They may not be qualified as job readiness providers. However, that is a change that we can make sort of en masse within the agency. And so I am asking, I have not received yet from OCP exactly what steps need to be taken so that we make sure that the providers are registered as qualified to do job readiness with RSA and get paid through the VR grant. So if someone is an existing person with RSA, it seems to me that what would make sense is that when the interdisciplinary team meeting occurs, that the VR counselor who's assigned should be invited to that meeting. And that way, when there's a discussion about what employment readiness services are needed, they can discuss it right there. The issue is that a person can receive employment readiness services, and what the provider is going to need to provide in advance is an outline of sort of the curriculum of what they will be providing as an employment readiness service. And they can then be authorized for a period of time to provide that service, which could then the authorizations are limited for the number of days of service you can get, but a new authorization can be issued. But what's going to happen is there'll be a review of what's been provided and then issue the new authorization to provide additional. The payment for employment readiness group or job readiness group with RSA is $50 per day per client, but this is in a group of between 2 and 12 people. And a day is defined, I think, as 6 hours. And so it does not have to be, it can be split up, but you bill for 6-hour days. And as I say, I apologize because I wanted to have a very detailed plan, but that we could provide to you in writing, but we will be providing that to you within the next week. So as providers are putting together their day, reopening their day program plans, we will have this finished so that you can see step by step everything that needs to be done. And I see a question, can we ensure that service coordinators are aware of this? We have talked about this on this call. I am not aware that communication has gone out because we don't have the full plan. The service coordinators will get that at the same time as everyone else does. And what's important is that service coordinators recognize that where employment readiness is being offered, that they should be inviting the VR counselor to the interdisciplinary team meeting. It may well be that the provider will not need to do this remotely and use VR funds. There could be circumstances where you could still do it through the waiver, but it would be most helpful to have both the service coordinator and the VR counselor available to work out what the funding mechanism for that service will be in that meeting and finalize what the hours are that are needed. And while the whole team is there, they could sign both documents at the same time.
Okay, we have another question. Any update testing? I'm not really sure what that is. Is now requiring bi-weekly testing in all ICS waiver, staff and people served. I am not advocating one way or another, just want to know if there's discussions about this.
That was supposed to be FL, Crystal. Florida, the state of Florida is requiring that.
Oh, okay.
So what we have most recently is the guidance regarding day services, and it explicitly says that there is no recommendation for pre-program or routine testing for people who participate in day. And at this point, we have still not seen any recommendation from DC Health for testing in either intermediate care facilities or residential habilitation placements.
And last question, do ER people need to have a planning meeting at the end of a CPAC?
Yes. I mean, at the end of a CPAC, if someone means to reinitiate employment readiness or job readiness with VR funds, should there be a team meeting? Yes, there should be. And we've tried to be clear that the community participation assessment and questionnaire is necessary for day services. And although this is a VR service, employment readiness is a day service. We're just figuring out another way to pay it so that some people can begin to receive it without having to be going into the community. And I see we're almost out of time. As I say that, without going into the community, one of the things I do want to say today is while we still should be thinking hard anytime we are going to go out about whether we really need to do that, I finally signed up for Peapod myself to have not advertising any particular company, to have groceries delivered so that I don't go to the grocery store once a week by myself. However, all of us do still need to get regular exercise and sunshine. And so even while we were under a stay-at-home order, for basic health needs, it's essential that people be getting out and moving around. Maintain social distance, face covering to the extent it is appropriate, but absolutely getting out and moving around. The people, I mean, for all of us, we need regular exercise, but it's absolutely important for the people that we support because there are health issues related to a person being sedentary for too long. I did see a question about an increase in positive results in supported living placements. The bump up we saw in July was higher in supported living than it was in other placements. With that said, however, it was very much in line with what we are seeing across the district, which is we saw the numbers really within the district move down to a low in June. And then in July, they picked back up again. And so even, for example, within DDA, in terms of COVID positive, in April, we had 140. In May, it was down to 50. In June, it was at 13. And in July, back up to 24. And in the district, you see the same kind of thing in terms of the average weekly number of people who test positive for COVID. And I expect part of what this could reflect is that people in supported living are making the same kinds of decisions that you and I are making, or that other people out there are making. You know, we do hear from the mayor's press briefing the kinds of decisions that people make based on contact tracing, where they can see that positive test results are coming about. You know, they're seeing an increase apparently related to people going to restaurants. They saw an increase in people going away on vacations. And this is why they put the restriction in requiring people to self-quarantine if they travel to particular parts of the country. And so we need to make sure that we are helping the people that we support make good decisions for themselves the same way all of us need to continue to be considering having very thoughtful decisions about the activities that each of us engage in. And so, you know, we have seen some bump up. In terms of the bump up, though, just so you know, so supported living went from 64 cases in April, 16 in May, 6 in June, to 12 in July. ICFs went from 2 in March, 47 in April, 20 in May, 7 in June, and 8 in July. Residential habilitation, 22 in April, 4 in June, 0 in I'm sorry, 4 in May, 0 in June, 1 in July, and natural homes, 1 in March, 5 in April, 8 in May, 0 in June, and 2 in July. It is also helpful. I just got the question, so I wasn't able to do it immediately, but I also try to look at the percentage result for each different kind of placement. And supported living and natural homes still have a very low percentage rate of people testing positive as compared to ResHab and ICF.
Okay, and last question. Do we need to submit our plans before the CPAC meeting? Is that right?
That is absolutely correct. And those instructions will be in the communication that either did just go out or is going out this afternoon. But that is correct, because the people that are on the interdisciplinary team need to review an approved plan. And those plans are being reviewed and approved by the Quality Resource Unit in consultation with Health and Wellness. Any other?
One question. Can someone please compile a list of common acronyms for agencies that serve the disability community in DC?
And I see that it is now about almost 1:10. So I need to look at my calendar, but I have this packed day. So I think I have another meeting coming up that I need to move on to. So thanks, everyone. I'm sorry I was a little late joining you. And we will talk again next week.